Hi, everyone. Welcome back to Clinicians Brief, the podcast, where we give you a glimpse into the conversations behind all of our Clinicians Brief content. I'm the host of this program, Dr. Alyssa Watson, and today I am absolutely thrilled to be joined by Dr. Niccole Bruno. Dr. Bruno is a veterinarian, and she's the CEO and founder of BlendVet, a certification program that trains veterinary professionals in diversity, equity, inclusion, and belonging. And while our podcast typically focuses on the clinical side of being a veterinarian, we know that there is just so much more that goes into our profession, and that includes connecting with our clients. And so that's exactly what Dr. Bruno and I will be discussing today as we explore her recent article, Why Veterinary Practices Need a Cultural Crash Cart. Thank you so much for joining us, Dr. Bruno. Before we jump into this really important topic, I would love it if you could give our audience just a little bit about your background, how you ended up starting BlendVet, and what you're doing now.
Well, I want to say thank you for having me. It's an honor to be on the show. So I am a small animal veterinarian by training. I graduated from Cornell in 2006. I'm a native New Yorker, and much of my career, I've been the only person of color in many of the hospitals that I worked at. And even prior to joining VetMed, it was very apparent that while I grew up in a city that was full of diversity, that as I started to navigate VetMed, I wasn't necessarily seeing that diversity reflected in VetMed. And so it was challenging at times going through the stages of the pathway into VetMed. I also have a younger sister who is a veterinarian, and that also played a role in me wanting to see more for the profession. You always try to pave the way for the generations behind you, but that generation was actually my younger sister, so very closely connected. And when I got into practice, there were so many opportunities I saw that we could bridge some of the gaps that we were seeing. And even practicing in New York City and then ultimately in Houston, I was always pretty surprised that many times there was no Spanish speakers in these hospitals, yet we had an abundance of clients that needed to have Spanish as the primary language. And so as I went into leadership roles and had an opportunity to kind of change and reflect upon what was needed in my hospitals, I realized that I wanted more for not just my hospital, but for the profession itself. And the timing of it was in 2020 when we were in the midst of COVID and even more barriers were coming into play in VetMed. And that was ultimately what led to me starting Blend and wanting to improve diversity, equity, inclusion training for veterinary professionals, but also thinking about how do we improve the next generation of veterinarians coming into the hospitals and workplaces in the industry. So we've been forging away with Blend for the last 3 years, and we have two legs of it, again with the training and then with the pathway development.
So let's jump right into your article. I noticed that you did structure this article using the analogy of assembling a crash cart. And when I read that, it kind of struck me like there's a couple ways you could have set this up. You could have set it up as like a cultural wellness plan or a preventive care strategy, but that's not what you did. And I wondered if there was maybe a deeper meaning behind that, maybe suggesting that lack of diversity in our field is more of an emergency.
Well, I will tell you that you give me much more credit because honestly, when I created the article, I wanted to make it more relatable to what we do every day in practice when we're looking at inventory and we're coming up with protocols based on scenarios in the hospital. And I felt like we should mirror this with DEIB because it's just as important. As I hear you saying this, I'm like, yes, I am completely in agreement that the lack of diversity in VetMed is an emergency, and it's something that does require a crash cart. But when I wrote the article, I wasn't thinking in that regard. I was trying to make it much more user friendly and how I would process things as a leader. But the reality is the lack of diversity in VetMed is a true emergency in VetMed, and if we want to approach it as a crash cart, I'm all for it.
Yeah, I am too. Just like you said, and giving us your background, hearing about your journey in veterinary medicine and that of your sister, it's no secret that this is a homogenous group of people. When I was in vet school, there was one person of color in the class behind me, none in my class. And so that was, 20 some odd years ago at Iowa State. But still, 90% of veterinarians identify as white, and women, are now compromising the majority. And I think that's been since around 2010. So, are there any hypotheses as to why the veterinary profession doesn't reflect the diversity of the general population?
There's a lot out there. Most commonly, people will say in the vet school arena, will say, well, they're not applying. And, you know, I don't think that's the case there. We have been seeing over the last few years, the AAVMC is reporting that there are more applicants of color that are applying into veterinary schools. But I also think that we have to go backwards and see other areas in the pathway into vet med and identify where are some barriers. And we know that so when it comes to educational systems in America, like not all schools are equally accommodating when it comes to programming, and when it comes to STEM opportunities, usually cities that are underrepresented, minoritized groups are not necessarily having access to veterinary programs. We also know that going into veterinary schools, you have to have a pretty extensive resume of hours that are required, of experiences, mentorship, recommendation letters, and very often, these experiences are volunteer experiences when we are in high school and or even in undergraduate, and not everybody can afford that. Some students require getting a paid job opportunity, so that they can actually get the experience but also be able to provide for their education or their family. And so these are areas that kind of prevent students sometimes from being in a position to be able to apply into veterinary school. And I think that there are opportunities there where there could be paid internship opportunities by more veterinary hospitals to provide that pain point. And then also when we think about veterinary school processes and applications, some schools have adopted a more holistic approach, utilizing and leveraging life experiences and other club activities or roles that students have been a part of, because we know that the more well-rounded we are, the more experiences we've had, it helps to shape who we are as professionals, and even how we navigate through veterinary school. But not all schools have taken this approach. And so I think that all of those play a role in why we are seeing a lack of that diversity, because there's a lack of support in the stages of the pathway. And, as far as like women versus men, I do think that the pay scale and the cost of veterinary school is also something that we have to factor in. But I also am surprised that as a profession that is predominantly female, that there are other opportunities for us to be more, I would say, more sensitive to the needs of a female practitioner, and when it comes to family, work-life balance, and pay, that I think we could do better.
Yeah. What are the projections for future generations in terms of both gender and racial diversity, if you know that?
So the AAVMC annually releases a report, and they, will outline the demographics of students that are applying into veterinary schools and what's the composition of those that are in school now. And according to their last year's report, men are about 20% of veterinary students. And as far as the population, when it comes to race, is 70% white. So when we're looking at a 90% white profession and still 70% of veterinary students currently are white, we're still not necessarily making huge headway over the next decade. And I know that a couple years ago, when I first started looking into this more, there was a report that talked about like the effects of the pandemic and how that will influence applicants over the next few years, because many students opted not to apply to veterinary school. They didn't have all of the requirements, or they did not have the experience of ours, because many hospitals would not allow people in, understandably. But that plays a role in the amount of hours that we're applying to. You're not as competitive as other students when you don't have those experiences.
Yeah, actually, when you were talking about the some of these students, especially high school students and things like that, not having the opportunity to volunteer because they might have needed a paid job or something like that. And I immediately thought of the pandemic because all of our kids were kept home, and my husband is a teacher, and there were so many of his high school students that were actually helping their younger siblings, and it took away from the time from their own studies. And so I definitely can see all of those places where the pandemic, we might not know, for years how that exactly will affect the applicant pool and things like that. So I want to talk about understanding the client base. This article was fantastic, and one of the first steps that you talk about when we want to overcome some of these barriers is just understanding and identifying the unique makeup of your practice's client base, because that's going to change significantly based on where you practice. So what characteristics and demographics should we be including when we're trying to define that population, define our particular client base?
Yeah, so cultural inventory to me was like that first step, and it's really looking at what languages come into our hospital. What are the racial, ethnic groups of client base that we see? What gender identities, what sexual orientation, like all of the identities that make people diverse, that come into our hospital. Where is there opportunities to identify? Do we have clients that are deaf or blind or need accommodations because of wheelchair accessibilities? Where are there opportunities for us to identify what is our client base? Because in order to identify that, then we can actually come up with a protocol, or we can identify opportunities to change things in our hospital, whether it be how we do our intake forms, or how we set up our examinations, or what resources we provide after the appointment, to make sure that there is a clear understanding of why those clients came in the first place and what the next steps are for their pet. Because if they don't understand, we're not getting the client compliance. They're certainly not coming back to our hospital. And from a business perspective, this is all relevant to what we do every day. We are a business. And so while we are performing the medicine, we have to understand the business case behind reaching out and understanding these barriers that show up every single day in the form of our clients.
Mm-hmm. And it affects the care that our patients get too, because if our clients aren't understanding our recommendations, or are not coming back for follow-ups because they didn't feel like we were meeting them where they were, or they were heard, that's going to affect how our patients are cared for too. How are you gathering that information, though? Some of that information can be sensitive, and so are there good, easy, non-intrusive ways to get that kind of info?
Yeah, so when I was in practice, a lot of times if I had a client that came in that there were multiple languages spoken in the household, if the primary pet owner, like a lot of times if it's a multi-language household, then the person that speaks English is bringing the pet to the hospital, but not necessarily the caretaker. And so I would always try to find out like who's the caretaker, because most of the time when you're getting a history, it's very clear that they're not the caretaker. And then I would ask, are there any preferred languages that we should be aware of, so that when we're coming up with discharge instructions, or even going over printing out medical records, like can we make sure that we have other accommodations for the primary care owner? And a lot of times people were very appreciative if I asked that question, because then I was able to go and either print out information in that language of choice. I put notes in my computer system to say, language is spoken in the household, Spanish, English, or Japanese. So that way, when they were coming in, it was almost like a client, like just cliff note of what we needed to do as a team. And because my teams were very aware of how important education was to me, they usually, if I was in a room and I started having the conversation about allergies, and they knew from the record that there was other languages spoken, they were printing up the information in that language. So that way, when we ended the appointment, they went in and said, okay, well, here's, what we need to do today. Here's the medications, but here's some information to go home, because we know the game of telephone. We talked in the rooms, and even in English, people don't, remember half of what we say. And so it is helpful to have it written down and out for them. But if there is another language spoken, not everything is translatable, right? Medical terminology is not the same, in any language. I see it in Spanish, like you can't always translate things from English to Spanish appropriately. So how do we expect people that don't have that medical background to be able to relay that, And so I think that is important. Intake forms too, we can be more inclusive when we're getting information from a client in the first place, asking, are there any accommodations that you specifically need, whether it's reducing noise level, whether it's meeting us at the parking lot and helping us come in because we may not have a setup in our hospital that allows people in wheelchairs or that need other accommodations to come in. Do you need a translator? If that person is, if we have a person that is deaf, they may come in with a person that can help sign for them. But if they can't, what is the preference in how we should communicate? Because a lot of times, there is a misconception that people that are deaf cannot communicate at all unless we are signing, but sometimes they can read lips. Sometimes they would actually prefer to write down their questions, and making sure that we prepare our teams for a longer appointment or being able to send out those discharge instructions. So the more information we can get from a client, from the intake form to then just taking our own notes and being better prepared for the next visits, help in the long run. And it makes those clients feel seen and heard, because that is a challenge that we have seen. I've experienced it even personally, where people come to me and said, their experiences at a vet wasn't necessarily what they needed, that they didn't feel that they were understood, or that they felt that they were almost put in a box of maybe having financial limitations based on their appearance, and they didn't get all of the scenarios or options explained to them. And then when I have now seen it in studies that come out now, because we're very fortunate, the Human Animal Bond Research Institute, or HABRI, they partnered with Petco Love in February of 2022, and they actually questioned pet owners of color of their experiences. And now that information actually validates my own personal stories that people would call and share with me. We now have it in a form of data.
So you mentioned how just integral your team is when you have these appointments, and helping you with your communication between clients, and helping clients be heard and feel seen. So how can we assess our practice's ability to meet these clients where they are? Like, what tools can help us evaluate our team's openness to and increase awareness, and really identify any personal biases or thoughts or feelings that our team is having?
Yeah, those are all good points, and I think everything is usually happening at the same time, but there has to be intentionality with it. I mean, you're doing your cultural inventory, right? And being able to bring your team in, because, at the end of the day, as a doctor, I'm cushioned in the back somewhat, but the team itself is more front facing with the clients and getting the phone calls of who's coming in. So including them into where are opportunities for us, and then hey, where are opportunities for us to expand our team and actually do a culture ad, where we're not just looking at team members to fit within our current culture. Where are the opportunities, because we do have barriers from our clientele? Where can we hire and recruit individuals to join our team that will help us with those barriers? So for instance, for me, I'm not fluent in Spanish. I understand more Spanish than I'm comfortable speaking, but I was very intentional about making sure that when I did job postings, that I specifically asked for, that I was okay with writing, bilingual, Spanish preferred, willing to train too, because so often in vet med, when we post job postings, we write experience is needed, or when we're in the interview, we want the experience. And my pushback is, how are people supposed to get the experience if we don't give them the first chance, the first job? And for certain roles, clearly, I mean, you can't be a vet and be trained you have to go to vet school. You need to go to tech school. You need, but in the context of like client service representatives or other supporting roles, why can't we train? Why can't we identify where there's opportunities for transferable skills that people may have that will bring value to our hospitals? I had a very small team, and there was a new hire that had no vet experience but was highly interested in working in our industry and had experience working in the automobile industry, and was like front facing, and I'm like, hey, let's give you a go. Or people that have had background in childcare. Like if you have patients for children and parents, you've got patients in vet med, right? And so being able to train them and to be able to help them be, navigate this industry, but they also bring value to us because they can point out opportunities for us. This particular team member pointed out how quickly our social media needed to get better, improve, and what are opportunities that we could do for that. And I was like, go ahead and make some posts, tell me what you would want to bring or what we would want to see. And again, there's generational differences too, and that was an opportunity for her to share what is important to her, and that attracts new clients, that attracts new potential team members, and it allowed her to feel like she was contributing and that she had value in our practice. And I think that that's what it's all about. People want to feel that they bring value to their workplace and that they feel seen, just as much as our clients need to feel that as well. And when we think about that from a recruitment and thinking about how we can bridge opportunities for both clients and our teams, the results is so positive, because then people want to come to work and because they know that they are seen and heard and valued.
That's absolutely wonderful. Finding the right veterinarian can feel like trying to find a needle in a haystack. The Clinician's Brief Career Center makes it easier to reach the perfect new hire for your practice with employer profiles, resume search, and twice monthly email promotions to more than 120,000 veterinary professionals. Find the right hire for your clinic at cliniciansbrief.com/career-center. I want to kind of go back to what we were talking about right before the break. We were talking about increasing diversity in our staff and really looking for those transferable skills, and maybe some of these things can be as important or even more important than experience in the veterinary field. I will say this has always been a little bit of a pain point for me, and as an associate veterinarian, I've never been an owner, and I've never really had any control or very limited control over business decisions like hiring in the practices that I've worked for. And so how can an associate veterinarian like me just better advocate for diversity within the practice?
Yeah, I've been asked this question a lot, and my first initial response is, I think all of us are leaders. We all have innate leadership skills. We have to tap into it, and leadership needs to be modeled. And so for me, because it was very important, like client education, and when I saw barriers for language, more so because of the cities that I practiced in, I made it a point to develop the educational content and translate it so that it was there. And it got to a point where leadership started to notice it, that my appointments, I did have the compliance, or that the appointments had, more of a clear understanding of what was going on. Your staff picks up on it. They start talking. And it's a way for you to then go to leaders and say, listen, over the last 3 months, I have created this, documents of different discharges, of different opportunities, and this is how it's been going. And I think opportunities further would be to look into hiring 1 to 2 staff members that could speak that language, and that would be able to either help us in appointments or to help us at the front desk when clients call. But a lot of times I say lead by example, and being able to then portray a plan helps to go to leadership and actually get what you want. I know it's easier said than done sometimes, because again, if leadership does not have its own growth mindset, then you're only going to be able to go so far. But I say that if I can just make a difference even in the clients that I see, then I've done as much as I could do. But for me, that wasn't enough, because it wasn't enough to just create a hospital that could and followed those guidelines. For me, that's why blend was needed in this profession, because I felt like at the very least, I could be screaming from the rooftops and be on podcasts like this and just try to get leaders more involved with understanding how important this is, but also empowering those that feel like you do, that they don't have a voice, to really say you do more than you think. Lead with that, and be the change that you want. And a lot of times that is contagious, and is able to kind of bridge those opportunities in the practice.
You talked about there actually is some data now about how clients, people of color, feel heard within the practice. Is there any data about how the presence of a more diverse veterinary staff impacts the level of trust and compliance among pet owners in our different communities?
Yes, so that same study I referenced before from Hobry and Petco Love, another point was 53% of pet owners of color want to see themselves reflected in the diversity of teams. And a lot of times that has to do, again, with the understanding of cultural differences, of understanding religious differences, or even language barriers. When I was in practice, again, people want to feel seen, heard, respected, treated with empathy. That takes time. And we already know that if there's a language barrier or any kind of cultural difference, like when we have 15 to 20-minute appointments, that we're already past the 20-minute appointment time slot. And so when we build out our teams and we have intentionality of who we're bringing in that can fit those barriers, you're able to empower your team to start those conversations. So, I practiced in Texas, and heartworm disease, very, very prevalent, and heartworm preventative is important, right? So we need to make sure that we're not just shoving an estimate with a whole bunch of numbers, because people see numbers and they know what that means, right? But understanding why those numbers are there and what is the benefit to their pet requires the educational component. And when somebody on your team is able to get past those barriers and even say, I know historically this is not something that we may have talked about, but it's really important. We see a lot of pets that have heartworm. You have children at home. We need pest control. These are things that over time these clients start to identify and relate to our teams. And then when I come in, my job is a lot easier now because they've been educated, and now they understand the importance of it. And and even in that education process, sometimes the limitation is a financial barrier, and not necessarily that they don't believe in it or don't care about it. And so navigating what that looks like requires time. And so again, if we can structure our teams where we understand that certain employees are going to need to go in and kind of play that educational component, I could knock out 4 to 5 other appointments while that is happening in one room. And that allows, at the end of the day, for those people that historically have not felt that they've been given the time or education to feel seen and heard. And that is a technique that I did very often. And again, it empowers your team. You're educating your team and telling them what value they bring in your practice. And you also have clients now that are better educated and are typically more compliant because they understand what that number means on the estimate.
And that leads actually really well into my next question, which is about, beliefs. So cultural differences and, maybe some religious beliefs that might differ between us and our clients. And so how can we, how should a clinician approach a situation where they feel like advocating for the pet's needs is in conflict with a client belief? For example, a client that has, refuses to consider euthanasia, that they feel that euthanasia is against their religious beliefs or their cultural beliefs, when we have a pet in front of us that we as a veterinary staff and veterinary team feel is suffering.
Yeah, that's a good question, and I think that it's very case dependent, and I think that it also starts off with the communication piece from the very beginning. And a lot of times, in some cases, you don't always have the years of a client relationship, to really know and understand and prepare those owners. A lot of times, sometimes euthanasias are the emergency walk in, and you have no relationship with the client, or I'm sorry, I even shouldn't say euthanasia because they're not wanting to do it, or it's an appointment that you have no relationship. And that's why I said you have to, tap into that empathy. I would usually tell clients that my job as a veterinarian is to speak on behalf of the pet. And I have done an assessment of the pet, and these are the options and opportunities for that pet, and here's the pros and cons with them. And I explain that sometimes, euthanasia is sometimes the option that would end this pet's suffering if especially if we're limited in what we can do. But if they are really truly, not, this is something again that's against their beliefs, then we try to come into a consensus of what can we do. Can we send that pet home with pain medications? What are things that owner should really be watching out for, to know for sure if their pet is extremely, like uncomfortable or in agony or is about to, unfortunately decline. I think the communication piece is key. And I think being empathic to clients, even if it's against your judgment, and even against what we are taught in veterinary school, because again, we don't know the why behind it, but our job is to provide the best care for that pet. And so I try to, find that common ground and try to advocate for the pet as best as I can in that voice.
Yep. And I think it's really helped me over the years to kind of shift the focus from the outcome of the case, whatever that is, to as long as I've done those things you talked about, as long as I have clearly communicated all the options, and then I really leave that decision in the pet owner's hands, because at the end of the day, they have to make that decision. They're responsible for the care of their pet. And that's just something that, has helped me in those situations where I sometimes feel like, there's this real internal conflict between what I think is best for the animal and what the client feels is best. So, you talked a little bit about time, about our 10 to or 15 minute appointments or 15 to 20 minute appointments, and how just it feels like staff is stretched so thin and resources are thin everywhere. And so while this is really a critical topic, I don't, sometimes it just feels like this is just another thing that's on our already overwhelmed, we're already overwhelmed. There's so much on our plates already. So I was wondering, are there places where we can use technology or artificial intelligence to bridge some of these communication gaps that can exist with us? You talked about handouts in other languages and things like that.
Yeah, I mean, and sometimes there's not always I usually reference like veterinarypartner.com because there is an opportunity to change the language. But even with veterinarypartner.com, not every case scenario is reflected in what they have to offer. And so even before AI, I would quickly type up discharges, or I would look at some other discharge instructions and create my own and then just hit Google Translate, right? And I think that there's opportunities to still leverage that. But what I get concerned about is with the AI, there is no human component, and the human part of it is still very much needed in vet med. And so creating that sense of empathy, it's one thing to use it as a resource for discharge instructions, or being able to change languages, or even communicate. I've had clients that come in speaking Russian and are pulling up apps to be able to translate for me in real time. But I think we have to make sure that, especially from a human component, that we're still leveraging and utilizing us and the skill sets that we bring, the emotional intelligence that we bring into vet med. And so I still think that there's room to navigate the pros and cons, but for most part, I still am very much pro-human.
Yeah, I certainly, this is a place that we're just seeing opinions all over. And as these, especially the language models, like you said, start to accelerate, we want to be careful and make sure we're not losing that human connection, and that we are using these technologies as a way to enhance and maybe streamline, but certainly these things are never going to replace, our veterinarian or our team or a radiologist or any of that, I believe. So.
I recently attended a conference where it was heavily focused on AI, and even then it wasn't necessarily transferable to vet med. It's more on the human healthcare side. So I still think that for us, particularly, we still have to do more of the research to figure out, like, is it even applicable to us as an industry? Because we already have, our patients don't talk as it is. So we are now relying on another set, another factor in interpreting what is going on with the case and the outcome for the case. So I think that, to your point, we definitely have to do more of the research and still heavily rely on the human side of it.
Yep, I agree completely. I want to talk about something that is a little tough. Unfortunately, I feel like in the US and even globally, there is a pretty significant anti diversity, equity, and inclusion movement. And I'm seeing it affecting everything from higher education to corporate protocols and, unfortunately, even some federal laws. And so I wondered if you had any tips for the team on how they might handle any criticism or negative feedback that might come their way from clients about including things like pronoun preferences or something similar on intake forms, because unfortunately I could see something like that happening.
Yes, I agree, and it's unfortunate, and I think that it comes down to the values that you have as a team, as an organization, and standing true to those. For myself, I was very much a hospital that welcomed all. I remember being a little nervous I practice in Texas. I put on our door, like, in this clinic we welcome, and it was a rainbow sticker, and it had a paw print in the middle, and it listed all of the identities. And I was nervous, but I said, this is what's important to me. And I want others to know that this is important for us. And, if you wanted to take it a next step, it's, creating a social contract. Or I've seen in places that say, in this hospital, we will not tolerate, abusive language. We will not tolerate discrimination. I think having, your values in full display will attract the people that you want to come into your hospital that have the same values as you, and will not attract the ones that do not. Because at the end of the day, those individuals that are not going to be aligned with us, there's likely going to be other forms of distrust in the examination room. And we know that we need trust in the veterinary client patient relationship. So for me, if this is important, if I want to feel seen and I want you to respect my differences, I respect yours. And being able to put that out, whether it's like I said, a social contract, which I think is great. Like, here, this is how our hospital operates. These are the values that are important to us. And as a client, we will provide these services, and we want these, we want to be treated this way as well. And have clients sign it when they're for new time clients. And then that way, when you have client forms that need to be updated, they have an understanding of why that information is being asked. But again, being transparent in communication, standing true to your values will attract the people that have the similar values to you and help you grow your business better.
So, Dr. Bruno, as we wrap up our conversation here, I would like to just come back to that idea of the power of empathy. And so, can you talk just a little bit more? You've touched on it throughout the whole podcast, but could you talk just a little bit more about the power of empathy for better serving our clients, and how this is really just a crucial component of leadership within our profession?
Yeah, no, and to me, empathy, I am a Brene Brown fan through and through, and she speaks about it so much, and I realize that when we lead with empathy, it really makes a difference in not only the outcomes that we have with our teams, but even with our clientele. To me, when you have a team, when you lead with empathy, you develop teams that are empathic as well, because they're willing to put themselves in the shoes of others, and that helps with all aspects of vet med in general. Like, I know it's hard, and I give a scenario sometimes when I'm talking, because I have a friend of mine that will be like, let me put my empathy hat on. And so I tell people, like, empathy is something that we have to practice every day, and you have to be intentional about it. And so I say, even if you have to, like, put the visual of, like, let me put my empathy hat on and let me go into this examination room, or let me have a conversation with this team member, with the understanding that I'm going to put myself in what their experiences have been, and why maybe it's taking them 3 weeks to bring their pet in that really needed to be seen 3 weeks ago, and that sometimes helps me to have a better understanding of where the barrier was, and how do I help them overcome it. And they appreciate that more, because you're speaking to them with definitely the compassion that's needed for them to feel seen and heard. And then for our employees, for me, I saw the differences so clearly when I would actually take the time to understand where they were coming from or what their needs were from the workplace so that I could better serve them as a leader. And so I believe that empathy is the bridge to compliance, but it's something that has to be truly practiced with intentionality, because it's not something that just, for some it's very easy, but for others, if that is a pain point of yours, then putting your empathy hat on is the way to go, and commit to it 5 minutes a day, and you'll find, just like you're growing a muscle, a bicep, you can grow that empathy muscle.
Yep. I love that. And I love the visual, just something a little to remind you, a little mindfulness, like this is what we're doing right now. And I think the other thing too is trying to wear that hat or put the hat on even when you're away from the client. I find that that's one place it's easy to come back into the back of the back and gossip starts, or we want to vent because
Yes.
we're all, it's very natural to want to vent and go through the frustrations, but to be able to, as you said, act as a leader, in that situation. Pause, take a breath, put your empathy hat on.
You know what? You made a very good point that I want to clarify, because I think you asked me the question earlier and I forgot to mention it. But that's where the DEIB training comes into play. Because like you said, we're human. So we're going to come in the back and we're going to take that empathy hat off and start, communicating and bringing in our own biases or the judgments that we may have. And that trickles down as a leader, or even just, it's toxic, right? It kind of wears on the team members. So making sure that you keep that empathy hat on, even in the treatment room, and really understand that if there are reasons for you to have those judgments, is there an underlying bias? And I think that that's where the DEIB training is so critical. And when you're navigating that with your team, if we're talking about bringing more diversity in our hospitals or our workplaces, then we have to have the training in place. Because if we don't create the environments where that diverse team member feels that they are welcomed and that they feel like they belong, they're not staying. And then that retention is gone. So it's really important to do it all at the same time. And I know that's easier said than done. But again, when you are taking the time to identify pain points and training the team, then you're creating the opportunities for that diversity to thrive in your practice.
I just want to say thank you so much, Dr. Bruno. We know that this work is hard, but it is very important. And I'm so glad that we were able to take the time to just sit down and talk about this. And hopefully our audience at home, took a lot of value out of this, just like I did today. So thank you again for joining us. And to you at home, thanks so much. We'll catch you next time on the podcast. Thank you for joining us for today's episode of Clinicians Brief the Podcast. If you enjoyed this episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Clinicians Brief the Podcast is a Vetmedics production, produced by Alexis Ussery and hosted by Dr. Alyssa Watson.